bracing for federal cuts to Medicaid. Kentucky lawmakers are working to get ahead of the changes. Today, the Medicaid Oversight and Advisory Board made suggestions on how to improve the efficiency of the state system.
Addie Miners was in that meeting today in Frankfort when the board finalized its suggestions.
There are as many seats in this committee room as there are opinions and issues with how the state runs its Medicaid program. But on Monday, the Oversight Committee took a big step in the right direction to fixing some of those issues.
And are we doing right by the people who receive these services, and are their outcomes better?
The Medicaid Oversight and Advisory Board has been meeting since July, discussing how to make the state's Medicaid system more efficient.
We're looking at things in a totality when it comes to reimbursements, to network adequacy.
After research and discussions, the committee came to several conclusions. First, it found a lack of transparency when it comes to how the state is spending its Medicaid funds. It also found that health outcomes from patients across the Commonwealth aren't significantly improving, even though the state is spending more money to improve them. A suggestion from the committee to address those issues is to create a centralized public health outcomes dashboard.
We can look at performance measurements when it comes to managed care organizations. We can look at performance when it comes to Department of Medicaid Services. We can look at providers and how they're performing. And we can use those measurements to make our system for Medicaid much better.
That is going to take a lot of collaboration, according to Representative Ken Fleming, the co-chair of the committee. Collaboration that the General Assembly has yet to see from the current administration, according to Fleming.
Because we made a lot of overtones, not only in the appropriations revenue, but also in this board, to try to get information from the administration. It's not coming. There's quite a few different laws that we have passed that have not been implemented.
All those in favor signify by saying aye.
Aye. Despite that, the bipartisan committee approved more than a dozen recommendations with the hope that they can be put into place before the state feels any effects from the federal Medicaid changes.
We do have different opinions, but we've come together and we've got a pretty good recommendations we feel comfortable with to recommend to the General Assembly, and we'll go from there.
In Frankfort, I'm Addie Miners, WLKY News.